Hello, my name is Dr. Dewan S. Raja. Today I will discuss the osteology of the Norma Lateralis, the lateral view of the skull. So this is the lateral view of the skull. We have bones and major suture like the frontal bone, parietal bone, the squamous part of the temporal bone, the mastoid part of the temporal bone. We have the external acoustic meatus and the zygomatic process, greater wing of the sphenoid bone, and the zygomatic bone, the nasal bone. So these are the bones we are seeing in our list. We have the major suture like that of the coronal suture here, and the squamoparietal suture, also called squamosomal suture. And we have the suture, the sphenoparietal suture here, and this is the sphenofrontal suture. Here we have the occipitomastoid suture, a part of the lambdoid suture here. Okay, so these are the important sutures on the Norma Lateralis. Okay, so if we go there and we just compare in our exact skull bone here, and we'll get the skull here. This is the Norma Lateralis. Here we are seeing zygomatic bone. Here is the zygomatic bone is here, the zygomatic arch is here, the temporal fossa, and underneath the zygomatic arch, the infratemporal fossa. We have the external acoustic meatus, and this is the mastoid process here. This is the parietal bone, the part of the coronal suture here. Okay, we have the Pterion here, we'll get it here, Pterion here. Okay, we'll get the Pterion, multiple bone are uniting close to this part. There is the Pterion area. Okay, so this is the lateral view of the skull. We are learning that part. Okay, we got that. We have some features like temporal line, zygomatic arch, external acoustic meatus, suprameatal triangle. Suprameatal triangle is present just posterior superior to the external acoustic meatus, and with the mastoid part of temporal bone, styloid process is coming out from the base of the skull. Okay, and we have the pterygomaxillary fissure. If we go to the infratemporal fossa, we'll get pterygomaxillary fissure that is communicating to the pterygopalatine fossa. Okay, so these are the features. Temporal line is not distinct in my specimen. Okay, but we have seen in our image, in our figure. Okay, attachment. Temporal fascia. Temporal fascia will be attached to the superior temporal line and inferior temporal line above, in the space between superior and inferior temporal line. And another part will be attached to the zygomatic arch area. Okay, so superior and inferior temporal line and the space between them and the zygomatic arch. Temporalis muscle. Temporalis muscle will occupy the temporal fossa. We have the masseter muscle that will be attached to the lower end, will go to the ramus of the mandible. Upper end will take origin from the zygomatic arch. The lateral ligament of the temporomandibular joint will go to the articular tubercle here. We have a tubercle here in the zygomatic arch, close to the external acoustic meatus. And muscles like sternocleidomastoid muscle, splenius, and longissimus capitis are inserting to the mastoid process from before backward. Okay, we'll get the attachment of multiple muscle on the mastoid process. The structure passing between the gap between the zygomatic arch and the side of the skull are the tendon of the temporalis muscle. Temporal muscle takes origin from the temporal fossa area. Okay, from the temporal fossa area. it goes underneath the zygomatic arch, and temporalis muscle will be inserted to the mandible, where in the coronoid process of the mandible. Okay, the temporalis muscle. Masseter muscle, it taking origin from the zygomatic arch going to the lateral surface of the ramus of the mandible. Both of them are muscles of mastication, so they should be innervated by the mandibular division of trigeminal nerve, and they arise from the first pharyngeal arch. Okay, structure passing between the gap between the zygomatic arch and the side of the skull, we just discussed. Tendon of temporalis muscle, deep temporal vessel, and deep temporal nerve. Okay, again we are looking at that. We have the temporal line here. Superior temporal line usually fades. The inferior temporal line continues and moves, then goes up and then moves forward and downward. Okay, going to the this crest area. Okay, so it will be over that. Okay, the crest, the suprameatal crest area. Okay, we got that. And this is the area for the temporalis muscle origin, including the temporal fossa and temporal fascia. Okay, this is the area, very important. Pterion. Pterion is the site of union of four bones. One, there is the temporal bone. Another one is the greater wing of the sphenoid bone. Another one is the frontal bone here. This is the parietal bone. So this is important, and this area around the sphenoparietal suture here. Okay, here underneath it we have the meningeal vein, anterior stem of the middle meningeal artery. Okay, middle meningeal vein, anterior stem of the middle meningeal artery, and also this part inside the skull is related to the anterior part of the stem of the lateral sulcus of the brain, also called sulcus of Sylvius. Okay, this is very important. Any injury here may lead to epidural hemorrhage because underlying blood vessel may rupture, may lead to epidural hemorrhage. Okay, and the clinical feature is usually person lose consciousness, again gain consciousness, become in lucid interval, again the person go through unconsciousness, coma, may go to death if it is not managed properly by bar hole surgery. Okay, we got that. And this is the asterion. Look at that. We have the lambdoid suture, parieto-mastoid suture, occipito-mastoid suture here. This is the area called asterion. Asterion is the fetal or early infant life. It was the posterolateral fontanelle. Okay, that gap has been closed, and posterolateral fontanelle here is ossified. It become closed by 2 to 3 months. Okay, so the gap was present. Gap is closed by 2 to 3 months after birth. This is the mastoid process. This is the site of the suprameatal triangle here, also called McQueen triangle, that is related to the underlying lateral wall of the mastoid antrum. Mastoid antrum is communicated to the middle ear cavity. Mastoid antrum, the site of infection. Okay, specifically we call it mastoiditis condition, mastoiditis, and the ENT surgeon approach to remove the pus by going through this area, the suprameatal triangle. So these two are very important. This is to the ENT surgeon. This is for ENT of a head injury. This part bone is thin and it is around 4 centimeter above the midpoint of the zygomatic process, around 2.5 centimeter behind the frontozygomatic suture. Okay, we got that. Now this is the temporal fossa, infratemporal fossa. So if we remove the zygomatic arch, we'll get the infratemporal fossa, bounded anteriorly by the maxilla, medially by the lateral plate of the lateral pterygoid plate, above by the, this is the greater wing, the sphenoid bone roof, okay, laterally by the ramus of the mandible and part of the coronoid process here and the condyloid process. Posteriorly it is open, floor is open. So we have a lot of structure in the infratemporal fossa. This is a temporal fossa. We'll get the muscle origin, the temporalis muscle. Okay, this is an individual temporal bone. Okay, we are finding out that this is the supramastoid crest here. Okay, and this is the external acoustic meatus. We have tympanic bone here, and this area is the suprameatal triangle, this area, and this is the site. This site is on the lateral wall of the mastoid antrum. So ENT doctor used to go through this site to remove the pus in the mastoid antrum. Okay, we got that. We have multiple fissure like tympanomastoid fissure for the passage of the auricular branch of the vagus nerve. We have the pituotympanic fissure for the it transmits the chordotympanic branch of the facial nerve. Okay, we got that. We have the mastoid foramen for the passage of the emissary vein that connects the posterior auricular vein to the sigmoid sinus. Okay, so we got that. This is the zygomatic process. 2/3 is contributed by the temporal bone, 1/3 is contributed by the zygomatic bone. Okay, we got that. And this is the mandibular fossa is here, articular surface that is part of the temporomandibular joint. Okay, we got that. So what are the important foramina? We just discussed tympanomastoid fissure, auricular branch of vagus nerve, mastoid foramen and emissary vein, and a meningeal branch of the occipital artery, an emissary vein that connects the posterior auricular vein to the sigmoid sinus. Zygomatico-temporal foramen contains zygomatico-temporal nerve, that is a branch of the maxillary nerve. Okay, pituotympanic fissure that transmits the chordotympanic branch of the facial nerve. Okay, we got the important foramina on the Norma Lateralis. Okay, and that's all about the osteology of the Norma Lateralis. If you have any question, please feel free to ask me. Please share the information with your friends. And please support my channel. Please subscribe me. Have a nice and wonderful day. Bye now.